Today I discussed with the audience about smouldering myeloma. And smouldering myeloma is a plasma cell disorder characterized by the presence of a M component in the serum, usually higher than 3 grams per deciliter, and or plasma cell bone marrow infiltration between 10 and 60%, but the main feature is that it is an asymptomatic disease, so there is not any myeloma-related event, so patients are completely asymptomatic, and in most cases the diagnosis is done at random because in a routine analysis the serum protein monoclonal component is detected. So first we have to do the diagnosis of smouldering, and when we confirm the diagnosis of smouldering, what we have to do as next step is to define the risk of progression to myeloma, because we know that smouldering is a heterogeneous disease, and we can identify patients at low risk of progression to myeloma, 1% per year, patients at intermediate risk of progression to myeloma, 3% per year, and patients at high risk of progression to myeloma, 10% per year. And in order to evaluate the risk, so we can use different risk models. But the most common risk models, and I would say the risk models already validated even in clinical trials, are the model proposed by the Mayo Clinic, in which we have to consider the size of the monoclonal component and the plasma cell bone marrow infiltration. And we know that when a smouldering myeloma patient has more than 3 grams per deciliter of monoclonal component and more than 10% of plasma cell bone marrow infiltration, the median time to progression to myeloma is of approximately 2 years. However, when these patients have only more than 3 grams per deciliter of monoclonal component, but the plasma cell bone marrow infiltration is less than 10%, the median time to progression is of approximately 20 years. So you can understand that it's very important for the hematologist to identify in which risk group each smouldering myeloma patient is allocated. So today, from the general point of view, the standard of care for smouldering myeloma is not treatment. So watch and wait, and when the disease becomes asymptomatic, so myeloma-defining events appear, so in this situation, patients have to start therapy. However, so if we apply the oncologic perspective, and in fact, if we are able to identify patients at high risk of progression to myeloma, the appropriate question is why not to early treat to these patients, especially in order to prevent myeloma-defining events, because myeloma-defining events means anemia, renal impairment, hypercalcemia, bone lesions with bone pain. So these myeloma-defining events impact in the quality of life of the patients, and this is the role of planning an early treatment for high-risk smouldering myeloma. And in line with this, so Spanish myeloma group conducted many years ago a phase 3 randomized trial showing that the early treatment with lenalidomide and dexamethasone in high-risk smouldering myeloma patients was of benefit, and in fact was able to delay the progression to myeloma with a benefit even also in overall survival. And now at the present time, so there are more than 50 clinical trials currently ongoing around the world in this specific patient population, high-risk smouldering myeloma. And there are 2 different approaches. The first approach is to try to delay the progression to myeloma, and for evaluating this approach there are trials using Lendex plus a monoclonal antibody or just a monoclonal antibody single agent, but together with this conservative approach there is also a more aggressive approach that is currently ongoing at least in 2 clinical trials around the world, and the approach is curative. So Spanish myeloma group together with the International Myeloma Foundation are conducting 2 trials in which we plan the potential cure for high-risk smouldering myeloma patients, and In order to evaluate this, what we are planning is induction with carfilzomib, lenalidomide, and dexamethasone, transplant, consolidation with carfilzomib, lenalidomide, and dexamethasone, and maintenance for up to 2 years. And this is basically the Spanish approach, and the American approach is similar, plus the monoclonal antibody daratumumab. Today we have to wait to know the results of these trials in order to definitely plan an early treatment for all high-risk smoldering myeloma.